Today I've learned that we are living with some diseases which we've neglected, and we are not even thinking about them. And they are there with us, killing our people in the community.
Health system strengthening is principally strengthening the health system to be resilient, to be in a position whereby it's able to meet the health needs of the populace. And WHO, the World Health Organization, has outlined 6 building blocks of a health system.
Building blocks are a WHO key thematic way of looking at how we can strengthen health. It looks at the infrastructure, it looks at the people or the human resource. It's also looking at the systems. Of course, you can have the people, you can have the infrastructure, you can have but then without the system, it has to work. Of course, there's also need for the health products and technology also itself. There's also the resources that comes along.
The other thing that we are focusing on in terms of strengthening is leadership and governance. And here we are looking at both national and county government. They have different roles that they play. At the national level is resource allocation and capacity building, and ensuring that the country has policies and strategies and that will enable successful integration. We are currently working on strengthening and building the human resources for health to have a fit-for-purpose human health workforce that is able to properly diagnose, manage and treat patients that have neglected tropical diseases, and with a key focus in the meantime on schistosomiasis, soil-transmitted helminths and lymphatic filariasis. But we've included other NTDs like snakebite, envenoming, rabies, just to ensure that whenever patients come to the facility, they are able to seek care.
What we have done, number one, how do we strengthen the healthcare system, is creation of more dispensaries into the communities. Because if you look at Magarini, it is the largest sub-county in Kilifi County, because of its vast distance and kilometers in where they can access healthcare services.
We are shifting away from a campaign-based approach where we'll do annual treatments, mass drug administration campaigns for prevention and treatment of some of the latent cases in the community. But with the integration, we want a situation where we work with the various governments, both at national and county governments, to be able to provide medication on a routine basis, and this will come in handy to ensure that some of the populations that are usually missed during campaigns can access medication during the routine treatment in the community. The other thing is close coordination with the implementers at the county. Integration in itself requires constant meetings, constantly engaging with the various counties, just to be sure that you're on track in terms of the indicators that you're trying to track. And this has really spanned out well and increased ownership at that local level as well.
We took the mandate ourselves as a county of starting this multidisciplinary team in visiting the household. Not only are we strengthening the dispensary level, we are also strengthening the community health workers, because we are there on the ground seeing what they are doing.
So for Siaya County, for us to be able to eliminate such diseases, the county is working very closely with the partnerships, all the way from the national government. The national government provides a lot of technical advisory, being that health was devolved, and the national government does both does research, does aspects of policy that will support the county governments in actualizing the health interventions within the county. So within that particular kind of a structure, and of course bringing on board the partnership that will support different aspects of dealing with NTDs, we are able to of course, work together to make sure that these NTDs are brought down.
The other thing is that we've tried to strengthen also reporting so that when data is captured at the community level or facility level, it can be channeled through the health information systems within the Ministry of Health. And this is important because its visibility within those platforms enable the utilization of the data for decision making.
We strengthen the building blocks of NTDs, like for example, health information. Yeah, I find that like the community health volunteers, we have given them phones that now they can use to collect data instead of manual. So you find that almost 90% of our community health promoters, we have given them phones purchased by county government, partners, and even national government. So we are able to collect our data real time, and that one reduces inaccuracy in terms of timeliness, in terms of completeness, in terms of integrity of the data. So that one actually makes we strengthen the system by providing technology. At the same time, you will find that NTD data used not to be in the mainstream system. So like in Kenya, we use Kenya Health Information System. So if you could visit those sites, then you find that NTD data used to not to be there completely. But now we are strengthening the system in that NTD data is also in the system, and we can collect the data from the source, be it health facility or in the community. Then we'll be able to transmit that data real time to Kenya Health Information System, and that data can be viewed by everybody in the world.
The EACHIS app has the name, has the sex, has the age. So I will click, and when I get to the neglected tropical diseases, when they give me any sign, I will refer in the EACHIS, and then I will do manual referral.
Mimi pia ni survivor wa hydrocell, na hii kitu kusema kweli imekuwa ikinisumbua muda mrefu. Hasa mimi ilinipata nikiwa bado ni kijana, na ilikuwa inanitatiza sana kwa sababu mimi nilikuwa napenda sana kucheza mpira. Sasa ikawa nikiingia kiwanjani inanitatiza sana. Lakini nimetafuta hayo matibabu, yenyewe haikuwa rahisi kwa sababu wakati ule ilikuwa unatembea mpaka Malindi, alafu kuna hivyo vipimo kwanza ulikuwa unagharamikia, alafu upasuaji wenyewe pia unagharamikia. But ujio wa hii county government na ushirikiano na Wizara ya Afya, kukaanza kuletwa hizo the free medical camps, zilianzia Malindi, na yenyewe hapo ndio nilipata huo msaada na nikaweza kupata operation. Kusema ukweli, saa hii mimi nimejitokeza as a male champion kuhamasisha, though a CHP pia huwa nahamasisha wenzangu ili kwamba wakaweze kupata hiyo surgery na waweze kurudia maisha yao ya kawaida. Na nimeona hiyo support inaendelea. Hata saa hii tumerudishwa Marafa, ambapo naona Marafa inafanyika vizuri sana. Inafanyika vizuri sana. Saa hii si season tena kungojea hiyo free medical camp. Watu wakipatikana wanapelekwa Marafa na wanatengenezewa hiyo operation mara moja.
In Siaya County, we've had high burden of neglected tropical diseases in the past, and we are fortunate to have this partnership, this cordial partnership with Amref Health Africa, to really try to really be able to improve, reduce the high burden.
Nilienda hospitali nikapimwa, ugonjwa hajipatikana, lakini ilikuwa siku ya watu kutoka sijui wametoka wapi, walikuja kuwabanda, alafu wakapima kipata na ugonjwa huu, na wakapea dawa. Hata kutoka siku hiyo mpaka saa hii sitakuwa na shida chochote. Nilizoea kutembea maji bila kuvaa protection yoyote, na tangu nikipatia na ugonjwa huu saa hii sitaenda maji bila kuvaa protection.
Ile kitu nilipata kwa hii lake tunatumia, nilipata kama hii maji wenye sisi tunatumia hii maji, tuseme hii village sasa, hii maji ndio tunatumia. Hii maji si maji utaenda uchote ukuje nayo ndio inakungojea. Hii maji unajua, unapata watu wako ndani, wale wakuvua samaki, alafu ile vitu inatupwa ndani ya hizi maji, pia huwezi jua juu vitu zinakufia ndani. Watu wanatupa vitu zenye hata si za kawaida hapo kwa hiyo maji. Alafu ile ilinishangaza sana. Mi naonanga mtu akikuja, akienda kuoga anaweka maji na besheni, anaenda anajiosha, anamwaga kando. Hii ni wala mtu anatoa nguo, anaingia ndani, anaoga, akishaoga hiyo uchafu yake, akishawacha hapo, anarudi. Akisharudi, by the time hizo hata haijaenda hewa kiasi, watoto wamekuja na mtungi, wanachota maji, wanakuja. Sasa niliona hiyo maji yenye iko hapo, juu nilionelea watu wote hawana uwezo. Hata hii kuchemsha maji, watu hawachemshi maji, watu hawafanyi chochote. Niliona ili tu mtusaidie, kwa sababu hii maji isipotumika hivyo, watu wanaitumia tu hivyo tu venye iko.
In Kenya, NTD programs have been donor-driven, and this kind of dependency on external support brings fatigue, because we cannot say these resources are always available. Furthermore, NTDs programs in Kenya are also parallel and siloed. They are not integrated within the mainstream health system. So we wanted to have NTDs integrated into the health system so that these investments or NTD services become cost-effective. Yeah? These services become sustainable, because with integration, there is a lot of government ownership where, government takes leadership in ensuring that they are integrated. And we do away with the issues of these NTD programs being parallel and siloed, and and also accelerate the elimination goals.
Let us work together. We love Amref Health Africa. They've really taught us so many things, and we appreciate. The national government also we appreciate. County government we appreciate. We cannot do without them. We need them each and every time.